Hi, this is Dr. Maggie Prevents, and I'm here to talk about prevention in mental health and why you should be concerned even if you don't work in mental health care or healthcare at all, and some economic facts and figures that will give you pause as you consider the impact in whatever country or setting you find yourself. Welcome to your channel. My name is Dr. Margaret Gani. I am a consultant psychiatrist transitioning from a mostly clinical career to one more focused on preventative mental health. On this channel, I share that journey as well as some bits about mental health and some of my experiences. As we all know, this is the month marked for endometriosis, and I have mentioned in previous videos that I happen to live with this condition, and so I'll be talking a little bit about this condition this month and my experience with it. Now let's go to preventative mental health, right? Why do I go banging on and on about it, and why should you care? Okay, well, last month, in February, I attended the public mental health conference. That's a preventative mental health conference, and it was on the 7th of February in London, and it was amazing for me. While I had to listen to the first part, I had to remotely access the first part, which was a little challenging when I was on the train to London because the network was patchy. It was great to finally get there and to be part of that atmosphere and to also meet some people both in psychiatry and in public health who are doing important things and who have paved the way for a lot of the public mental health being done. These involve people like Kevin Fenton, the public health faculty of public health lead, Subodh Dave, the Dean of the Royal College of Psychiatrists, and Peter Byrne, a consultant liaison psychiatrist in London who has been the co-lead of the um, PMHIC, the Preventative Mental Health Implementation Center, or something like that at the Royal College of Psychiatrists. But it was really good to, either meet or listen to these people. Just as a recap, what is public mental health? It has a number of definitions depending on where you see it. And at that conference, someone called Professor Anne John described it as the science and practice of promoting mental well-being, preventing mental health problems, and addressing mental illness on a population, community, or system level. And she mentioned how the components could include things around prevention, promotion, access to care, and public policy. In my own pathway, I am moving from focusing on the clinical approach to some of these things to a more promotion, prevention approach to these things. Now, recently I had a question from one of my followers on TikTok. Shout out to Hachi Ginger. And she was asking about, what aspects does preventative mental health cover? Is it actively clinical or different? And so I told her I'd try and answer her via video. And honestly, preventative mental health covers a whole range of things. The truth is that if you're already working in healthcare, especially in mental health care, but in healthcare generally, you probably are doing some preventative mental health care, whether you realize it or not, right? When a person presents with self-harm or with thoughts of suicide, some of the interventions we put in place or you might put in place are already in some way a form of preventative mental health care. When you've got a person with a severe mental illness on a number of medicines and you see them, admit them, treat them, discharge them, sometimes the interventions you put in place, the resources you signpost them to, could be a component of preventative mental health. So it's important to realize it's not this exotic thing far away that we need to get done. It's something that is already involved in our everyday practice. And something that was reinforced at that public mental health conference recently was that there are so many ways to get involved, right? You can get involved in research, you can get involved in advocacy, policy, clinically, right? You can get involved from the more public health angle. And so there are so many ways a person can get involved in preventative mental health. It depends on what your interests are, where you find yourself, what your goals are. And so if you work in the NHS, for instance, as a psychiatry doctor, right, it would involve or it could involve things like getting involved in early intervention exercises. There's the early intervention service here in the UK, which mainly focuses on things related to psychosis. But if you think in that early intervention mindset, what can we do early to intervene, right? So that things don't get much worse than they are. Now, now I want to make the case economically for why, in whatever sector we find ourselves, it might be important to think about preventative mental health. Now, recently, I have been looking at some of the publications by David McDade, who I believe is a health economist in the UK, who has done quite a bit on the economic case for preventative mental health and what are the returns on investment that some of these interventions can lead to, and why should we bother. And honestly, this is linked to my consultancy plug-in for my mental well-being consultancy there, and some of the services we are offering. So let's see, what are some of the things that have been talked about? I hope you're still following. This is Dr. Maggie Prevent, a psychiatrist transitioning from clinical to prevention, right? Now, the particular report I'm referring to is titled "The Economic Case for Investing in the Prevention of Mental Health Conditions in the UK," and it has as the authors David McDade and Ala Park. I hope I got that correctly. And I believe that this was a report prepared for the Mental Health Foundation in 2022 or so. There are a number of other co-authors, and some of the interesting facts and figures in this document are what I will go ahead to share. So now, mental health problems cost the UK economy at least about 117.9 billion per year. That's billion with a B. And I don't think the figures will be too widely different if you look at other countries around the world. And the estimated cost to each country, the impact of those mental health problems is significant. As I have mentioned, I have worked in clinical psychiatry for a while now, and I have seen, mental health at the other end of the spectrum when people present with significant mental ill health. And I've been privileged to support people when they present, but I also now want to help to intervene earlier in the life cycle so that hopefully I can support people not to get to that, more severe level. Now, there are a number of interventions that have been proven to help prevent distress and reduce the costs associated with mental health difficulties. They include things around, helping or training health visitors to be able to identify women at risk of perinatal depression and providing psychological therapies for those at risk. There are things around parenting programs, anti-bullying programs, supporting things like exercise for children, young people, and adults, identifying those at risk of poor mental health and intervening early, and identifying mental health difficulties in the workplace and providing, brief psychological support. Now, keeping that in mind, right, since we've talked about how these poor mental health can cost, over 100 billion per year in the UK, it's important here to mention that that cost does not even take into cognizance things associated with reduced performance at work because of a mental health problem, right? It doesn't include costs related to the criminal justice or housing sector, or costs related with alcohol and substance misuse, or costs associated with private treatment. And I mention those because part of what I hope to do by sharing about preventative mental health on this channel is to show that the impact of poor mental health affects not only the healthcare sector, it affects a variety of sectors, right? We've seen how it could affect, we've seen the criminal justice sector mentioned. It could affect things related to labor and productivity and many other sectors. And so it's important to think about, supporting prevention because it covers a whole wide range of sectors. Now, there are some, details, more details around the examples of cost-effective interventions. And for instance, for working age adults, there are brief psychological interventions that can make a difference within the workplace. And there are interventions that can make a difference for people with long-term physical health conditions, interventions for people at risk of self-harming, interventions for older adults. And for me, right, for the consultancy, what are we thinking of? How do we think we can intervene? Well, we can't do everything, that is obvious, but we can do something. And here is some of what we can offer. We can offer individual sessions, and if you go to my bio and click on the links, you can go book a session on Calendly. We offer group work or corporate packages. We also offer individual packages, and we also can offer bespoke packages which are tailored to your specific needs. And because poor mental health can cause problems with presenteeism, absenteeism, and increased turnover in the workplace, we think it is important to provide interventions within the workplace. Now, why us? Well, I bring a range of skills and expertise, having spent quite a while accumulating knowledge and skills related to this. I am a consultant liaison psychiatrist, so I am trained and have worked at the interface between mental and physical health. I am a medical doctor who has done a residency in psychiatry. I specify that because not everyone seems to be aware that psychiatrists are medical doctors. I have also trained as a cognitive analytic therapist, which is a separate course which involves about 2 years of academic work and a number of other bits and bobs. And then there is clinical casework as well, which tends to take longer, and a few other bits. So I am an accredited therapist as well. And then I am a public health professional as well. I have done a master's at the London School of Hygiene and Tropical Medicine in public health promotion, and I have also worked in public health. And so I bring the knowledge and skills and experience from these different parts of the system together, and we use it to tailor the interventions to support you. So for instance, our preventative mental health service within a workplace could look something like this, right? We come in, we do a workplace mental health audit to try and understand what is the current situation, right? How are your employees doing? What's the environment like? What's the atmosphere like, right? And then we can put on some workshops around stress management, resilience, leadership, performance, tailored to your needs. And it could be a one-off thing. It could be a regular thing, maybe monthly or quarterly. I'm sure you have all sorts of well-being interventions and retreats and packages, and we could be part of this. We could also provide one-on-one therapy support if and where it is indicated. And if we identify people at high risk of burnout or stress, we could put early intervention programs in place. And then of course we can offer executive coaching type interventions and a whole source of other things. And we can continue to monitor and provide interventions as the need arises. So that is some of what we can provide, hopefully leading to a decrease in absenteeism, a decrease in employee turnover, increased positivity in the workplace, increased positivity and better productivity, right? And it will enhance your organization's reputation as a mental health conscious employer, right? Because you are improving recruitment and retention, and people who work with you tend to do better. And you will be contributing to improved mental well-being, in your society, in your community, because people who are doing well mentally, whose mental well-being is in a good place, they tend to be better partners, better parents, better colleagues, better neighbors, easier to get along with. So that's some of what we'll be offering, and I hope I have summarized, why you should bother about preventative mental health. I hope I've answered Hachi Ginger's question a bit, and I hope I have also, shared some of what our consultancy will be offering. Please check my bio, book an appointment on Calendly, and I'll see you around. So this is Dr. Margaret Ghani on my channel, Dr. Maggie Prevents. Remember, things talked about on this channel do not replace clinical care and support. Please reach out to specialist or a physician or a healthcare service in your local area if you're struggling. And remember, prevention saves lives, and that includes mental health prevention. Thank you. Take care. See you in the next video.